All right, so first of all, thank you to Drs. Jackson and Alasky for the opportunity to talk about a couple of subjects I'm really passionate about, manometry and the Facebook group. So I have no disclosures, and I'll sort of let this ride along for the required 7 seconds. And so what is manometry? Well, I can tell you that is representations of pressures along the esophagus. But to me, really, what it is the most elegant and the most beautiful representation of esophageal physiology that you will ever see. It is also something else. I'm not sure if, are there any Game of Thrones fans here in the room? All right, you might remember this piece of advice that one of the key characters gets. Knowledge is a weapon. Arm yourself well before you ride into battle. Now, we don't do battle, we do surgery, right? But sometimes it feels like a battle. Sometimes you're stuck in there in the muck, and it's just hard, it's a struggle. But if you have the right weapons, if you arm yourself well, you're much more comfortable taking on these battles. So the talk is called Manometry 101. So my basic speech is that, like I said, representation of physiology. And what we are seeing from top to bottom is the esophageal anatomy. From left to right is time, just as it would advance on an EKG, on a Doppler ultrasound. And it's really intuitive. The blue colors are the cool colors. These are low pressures. And then as things heat up, as the colors get brighter, then the pressures are starting to rise. So we can see do I have the mouse? Well, we can see at the top the high band of pressure, that's the upper esophageal sphincter. At the bottom part of the screen, the lower esophageal sphincter, anything between the esophageal body. And so we know that the first thing that happens for swallowing that the esophagus does is that the upper esophageal sphincter relaxes, and so that's the first thing we see in this frame, the swallow, and then it contracts, and this sets in motion this whole swallow. I always tell my residents and students, think of a tube of toothpaste being squeezed. If you want to get all the toothpaste out on a single motion, you would start at the top and slowly roll along towards the bottom. It's the same thing that's happening here. Of course, the cap needs to be off if any toothpaste is going to come out, so the LES needs to relax to allow that bolus to go through. And I did say we have some anatomy there. We know that the esophagus is comprised of striated and smooth muscle. So at the top, we have the striated muscle contracting, and you can see that a little after the very part of the top, the wave sort of tapers off, and that's this transition between the striated muscle and smooth muscle. And we are also told that the esophagus has 3 constriction zones, right? The UES, the LES, and the aortic arc. So see this thing at the middle of the esophageal body here, sort of going thump, 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 thump against the esophagus. Well, folks, that's the esophageal arch, sort of impinging against the manometry catheter. This is a little different, but we also have some indentations lower alongside the esophagus. Well, what other anatomic relations does the esophagus have? We know it is intimately related to the left atrium of the heart, more closely to the abdomen. So again, we have this thump, 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 thump indentation here. So we are seeing how this is related. This is a little bit more funny-looking study. We see that we have these almost look like esophageal spasm, these contractions. After I saw a few of these, and then I would see a picture like this, and I'd look at the patient's chart, look up their BMI. Sure enough, this is an obese patient. So when the patient's breathing in and out, that mediastinal fat is pressing along the esophagus and creating these indentations. If you're not experienced, these could really confuse you and say, oh, what's going on here? But this is just purely anatomy and physiology being displayed. I don't have a lot of time to get into why you should get manometry, but we already had a few great talks on this. If you didn't catch them, be sure to look up the slides or watch them on YouTube when they come up. But I do want to emphasize that manometry is part of an essential workup alongside with upper GI, with EGD, with pH studies. I call this the Holy Grail of foregut workup. You have all this information that you need. Now, I represented it here as circles, but I like to think of them as pieces in the puzzle. And if you're lucky, all the pieces of the puzzle come together and they match perfectly. And if you take all these and you put them in a big frame called patient symptoms and his or her goals, then you have all the picture. Then you have everything you need to tackle any foregut disease you are facing. So why should you care? Why? I mean, this is super nerdy stuff. Well, folks, what do you do when you order a CT scan? What do you do when you order an X-ray? What do you do when you order an ultrasound? Do you wait for these guys to roll around 8 a.m. in the morning, big latte in their hands? No, you take a look at the studies yourself. You learn how to interpret them yourself. So it's always a process of learning, but in the end, you always take a look at things for yourself. Then you correlate with whatever the radiologist or someone, specialist said and say, oh yeah, I was right, you know, I'm really, 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 really smart. So what if you have a busy clinical practice and you have a lot of patients and you don't do exclusively foregut, you have other interests, maybe you're a community surgeon. Well, that's okay, folks. You don't have to become a master, you know. That's why we're here. This is one of the beautiful parts of the foregut group. We have a lot of experts on esophageal manometry, and you can always ask for help. We have a post here by Dr. Doyen saying, hey, and I know she's being humble here because she's saying I'm new to HRM, but I know she has some experience on it. She's asking a question like, we have this new machine, can anyone help out? A few of us did. I think we responded. Dr. Grimmer here saying, oh, hey, my facility changed to some new reporting system, and this is confusing me. Can anyone help out parse what this means? Again, a few of us chimed in, sort of helping her along to get used to this new process. Lastly, I was asked to talk about how to prepare patients for esophageal manometry, and I will let you in on a little secret of esophageal manometry. It is an uncomfortable procedure. It is not fun. It is really, it is truly, truly an uncomfortable experience. So you need to tell folks as much. You need to tell them, hey, I'm asking you to take this study. I know it is hard. It is not comfortable, but I really need this in preparation for whatever decisions are going to be made. So this is my own manometry I had done up in Seattle. And this is the beginning of the study. I was pretty uncomfortable, pretty apprehensive. But what I had was Muna, who was our nurse there, and she was really an angel, really able to calm me down and guide me through the process. And so you see, by this point, I was smiling, which is really an achievement. So this is what you really need. You need to, in order to prepare patients, you need to let them know it's uncomfortable, but you also need someone who has the patience of a saint in the room taking the study, because that's what'll get patients through it. This is my own study, and this is a beginning part of it, and you can see how my upper esophageal sphincter was really hypertensive because I was really uncomfortable. I was finding the catheter all the time. You know, it's just a truly uncomfortable feeling, but as the study progressed and I got a little bit more comfortable, Muna helped me out a bit to calm down. Well, then my UES got normotensive. It was actually hypertensive in aggregate, but I'm going to chalk it down to the fact that I was nervous at the beginning of the study. So my take-home points are just that manometry is an integral part of foregut workup. You should get familiarized with the basics of it. And again, you are not alone. You can always reach out for help.